So I'm here at Ranscock 19 with Drew Moir, who's from, I'll let her introduce herself.
Sure. So I'm Drew. I work out at Sunshine Hospital in Melbourne's western suburbs as a junior obstetric doctor.
And so Drew's presented some really interesting research today about vaccine uptake. So can you talk us a bit through the study?
Yeah, sure. So it was a study which looked at women's vaccination choices as well as uptake rates of pertussis and influenza vaccine during the antenatal period. We had some really great numbers, so we ended up with 1,300 women completing the survey, which gave us some really interesting information. We had a really great mix of diverse ethnic backgrounds, with Australian women comprising only half of those that we surveyed. Some of the interesting findings were, first of all, that still less than 50% of women are having their influenza vaccine, but rates of pertussis vaccine were a lot higher, sort of around 82%, which was fantastic. We also found that some of the reasons that women identified as facilitating their having their vaccines during the antenatal period was basically all about healthcare provider recommendation. So the women who were told by their healthcare providers to get their vaccine generally got it. And interestingly, of those healthcare providers, women said that they were mostly recommended by GPs and midwives over obstetric doctors. So we've definitely got some work to do there. In terms of the things that prevented women from getting their vaccines, the things that we identified were system barriers, so not having access to the vaccine in an easy way. And one of the things that we've done to improve that within our service is having the antenatal vaccination clinic co-located to our antenatal clinic, so women can just pop over, get their vaccines done then and there, then it's all sorted. And other things that were barriers were basically not receiving a recommendation from their healthcare provider, and also not having enough information about how important it was to them and their baby to receive their vaccine.
So you said you were a bit surprised, you were expecting perhaps like an anti-vax kind of element, but that wasn't?
Yeah, we were sort of expecting that might be contributing. We know that's a lot in the media at the moment, but really we found that wasn't really a big deal. A lot of women when they spoke about why they didn't get their vaccine, it wasn't that they didn't believe in it or they had issues with vaccines. It was more just that they ran out of time, they couldn't get access to it easily, they didn't realise they were supposed to, nobody told them to. They were much more common than people who were truly sort of adverse to receiving their vaccines.
And what were your sort of take-home messages from the study for people today?
Yeah, so I think in line with the theme of the conference, I think it's really important that we continue to involve discussions about vaccinations and antenatal vaccinations with all of our patients in all of our consults.
And anything to stop?
No, I don't think so. I think continue is the key message there. Yeah.
Very good. Thank you so much.
Thank you.